Hi and welcome. My name is Dr. Michael Gartner. I am a board-certified plastic surgeon and I am here today to answer the most common questions I get about breast augmentation. So, getting right into it. Question number one, how long is the recovery time before going back to work? This is an excellent question. This question is almost asked every time I see a consultation. So the recovery time for breast augmentation is usually less than a week to go back to like a desk type job. There have been many patients where I've done this on a Thursday and they would have like a 90-95% chance they would go back to a desk type job on Monday or Tuesday. But if you have a job where you're standing long hours, moving around, it's more physical, you're lifting up hair dryers, things like that, or you're a nurse in the hospital, then I would recommend 1 week, okay? First 2 days are always the most discomfort. The third day always gets better. You may have some residual soreness for a few weeks. Usually by 3 weeks, I let patients do whatever they like to do, all right? Why do we put breast implants under the muscle? So the muscle we're talking about is the pectoralis major. It's like an upside down triangle coming across the chest. It covers the implant like 3/4, not the whole thing. So the lower outer part is sometimes the part you can feel. So the benefit of that is the coverage of the muscle prevents wrinkling or rippling, especially if you have thin skin. So if you're really super thin in a bra, bathing suit, you might see wrinkles or ripples, okay? Now you still may see that on the lower outer part, but at least that's covered by a bra. But also with underneath the muscle, they stand up longer. So the muscle acts like a sheath and the implant kind of sits on the inframammary fold, which is like a little ledge there. So you're relying on very little skin to hold up the implant. And your skin does get weaker and it does get thinner as you get older. If we put the implant on top of the muscle and it's all skin, we're relying on the thickness and texture of the skin to hold the implant up, which in many cases it doesn't do very well and it starts sagging even after a year, okay? And the third reason I like going underneath the muscle is to reduce the incidence of capsular contracture. Capsular contracture is when you develop like an orange peel scar around the breast. This under the muscle in my practice happens about 1 or 2% of the time. On top of the muscle, it can be high as 20 to 25%. Most patients, fortunately, develop a very thin scar. It's almost like a balloon around the implant. It's so thin, you have nice soft breast, you don't even know it's there. Capsular contracture, you develop this orange peel around the implant. It can raise the implant to a funny position. It might cause pain. And in order to remove that, we might not need a revision surgery to improve that. So the risk of that going underneath the muscle, once again, is 1 or 2%. On top of the muscle, it could be 20-25%. And so that's also the next answer is also the next question. How do you prevent rippling of breast implants? Well, the part under the muscle is prevented. The part exposed, you don't, unfortunately. And that just depends on how thick your tissue is. If you have very thin tissue, you might have some rippling there. If you have thicker tissue, then you may not. All right. And those are the most common questions I get asked. Hope you have a great day and stay safe.